So a lot of parents have asked, how do I know if my son or daughter has a tongue tie? You know, for us, looking at it visually is not the best way to determine that because sometimes the patient has a posterior tie and you can't really see it. So looking under the tongue and having them lift their tongue up is not the most effective way. I do believe that's often used as the determination on whether or not a child needs a tongue tie. And I do believe for many patients, it's overdone in that circumstance. So we look at it from a functional standpoint, and here's how you would know. If you have your child comfortably open as wide as they can and measure that with whatever way you have it at home, you could find out what their maximum opening is. For a lot of kiddos, it's 35 millimeters, maybe more. For them, what we often ask them to do then is take their tongue and the tip of it and they have it stick it behind their top teeth where they normally pronounce the letter N. So we sometimes say put it in the Nancy spot. So they go na 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 na, and we have them stick it up behind their front two teeth, kind of on that little tissue bump there, and that's called the spot. And so once we have them do that and hold their tongue against the spot, we have them open as comfortably as they can and as wide as they can again. If a patient can't open at least 50% of the way from their maximum opening, they likely have a functional limitation. So we're looking to make sure that kids can open. If they open 45 millimeters, we want to see them open at least 22.5 millimeters wide. If they can't open that far, they probably have a functional tongue tie, and that's when we start to address it and discuss how we can come up with a solution.